guys, welcome to Southern California EMS Training Institute. My name is Tyler, and today we're going to be talking about naloxone hydrochloride. Naloxone hydrochloride is actually a medication that's used to treat opiate or opioid overdoses. So opiates are going to be a lot of our drugs and medications that are going to suppress a lot of patients' pain. Typically these are downer medications or depressants. Things like heroin, that is an opiate. Things like morphine, hydrocodone, hydromorphone, Dilaudid, right, Vicodin, those pain medications you guys are probably a little familiar with, those are opiates. They actually attach to opiate receptors inside the brain and kind of help depress a lot of things going on inside the patient and depress the patient's ability to feel pain. Is typically why these patients are going to take it or why they're prescribed to patients. Sometimes when patients overdose on this medication, we need to give them a medication that's going to take away this overdose so we can keep them breathing. What typically happens when a patient takes too much opiates or opioids is it depresses not only their respiratory rate, right, but also depresses their brain function and their central nervous system. And it can actually also, one of the key signs and symptoms we see of this is it actually constricts their pupils and makes them really small, or what we call pinpoint. So those are the three telltale signs we're really going to want to look for inside these patients. You can also see that maybe it's going to lead to some bradycardia or hypotension as well, but really look for the decreased mental status and the decreased respirations. The decreased respirations is actually what's going to kill your patient and what we want to fix right away, which is why we go ahead and we administer these medications. So naloxone hydrochloride, trade name Narcan, right, comes in a couple different forms. Number one, it comes in a peach box like this, known as a preload. This is typically how we carry it on advanced life support unit and how you might be carrying it on your basic life support unit. It also comes in two other forms. Another form it comes in is actually like this. It's an auto injector, similar to your EpiPen, and it's a voice-activated auto injector. These typically are prescribed to patients who are either known to have opiate abuse, or maybe you've also been prescribed some sort of opiate or opioids at home. And then the last way it comes is it also comes in a little intranasal device similar to this. This is actually how PD and law enforcement carries it. And a lot of EMTs actually, you'll see it administered in this form. Now, we have two routes of this medication. The dose is going to be dependent on the route and what your medical direction approves and your protocols. But the route is either going to be intranasal, up the nose, right, or intramuscular. Again, it depends on how you're going to do it. Most of the time as an EMT, we carry it in the intranasal form. So that's how we're going to show it to you today. Now, the intranasal form, you guys, I'm going to show you and walk you through how to go through that and how to set it up. But before we give this medication, we need to do a couple things. Number one, is it indicated for this patient? So our indications for this patient is any suspected or known opiate or opioid abuse, right, with, again, altered mental status or CNS depression, respiratory depression, hypotension, and bradycardia. So if we suspect that maybe this patient overdosed, maybe we see those pinpoint pupils, and there's notice of, like, we see drugs that maybe have been abused, then we can maybe think about giving this medication. Also, approval from medical direction is the other thing we're going to want to look for as far as indicating for this patient. Contraindications, there's no contraindications for this patient, so we're going to be okay. We do want to be aware of some side effects, that if the patient takes opiates or other opioid medication for pain, giving them this medication can result in that pain to come back and then to start to feel that pain, and that's going to be pretty discomforting for the patient and going to put them in kind of a bad mood. A couple other things, we don't want to give it too much too fast. That can lead to complications with our patient, but when we're giving it intranasally, typically it's going to be okay. So now that we know it's indicated for our patient, all right, what we're going to do, again, contraindications, no allergies. If this patient's unconscious, we might not be able to know that, but for this, again, what we're going to do is we're going to set it up and get it ready. Talk about setting up and using our naloxone hydrochloride, our preload. So when we're using this device, we're going to go ahead and remove it from its box. And we're going to go ahead and take out our medication administration device, and then our medication itself is going to be right here. What we're going to do is we're going to go ahead and remove these two caps on our medication device. And we're actually going to go ahead and remove, right, the purple cap from our medication. We're going to go ahead and insert these two devices together. All right, we're going to insert, and we're just going to twist it on until it's nice and thumb tight. And now our medication administration device and our medication is ready to go and ready to be administered. We do want to be aware that right on the side of this tube right here is we have our medication hash marks, or our dose hash marks. So we can see that we've either administered 0, 0.5, 1, 1.5, or the bottom of being 2 milligrams. So we want to, if our dose only requires us to administer 0.5 milligrams, we want to make sure we don't go below that first hash mark there and only administer the correct amount of the medication. Now again, since we're EMTs, we're going to be administering this medication intranasally, which means we need to be attaching our MAD or mucosal atomizer device. And we're going to be inserting that into the patient's nostril. Right, and we're going to go ahead and spray this up our patient's nose. Typically what we would do is we'd give about 1 milliliter per nostril. So if I'm going to give 2 milliliters of this medication, I'm going to give 1 milliliter here, 1 milliliter here. Again, follow whatever your dose is per your protocol and your medical director, but you're just going to go ahead and squeeze it and administer up the patient's nose. After we give that medication, we're going to be reassessing our patient for any changes, reassess their mental status, again looking at their alert and orientation, maybe their GCS and the AVPU scale. Also be reassessing their respiratory status. Are they breathing? Are they breathing well on their own now? Check skin signs, pulse oximetry, all those other things. And reassess a full set of vitals and be getting your patient down to the hospital. Again, this is also a pretty short acting medication, so we might need to re-administer another dose, but be careful. We also want to be aware, don't give too much of this to your patient and too quick. Sometimes these patients will wake up. When you take away that high, they'll be really angry, frustrated, maybe even combative, and they can also be vomiting pretty profusely. If you're in the back of my rig, I do not like vomit. Don't really like combative patients either, so we don't want to give too much of this medication too fast. We can keep those things from happening. This is naloxone hydrochloride, you guys. I hope you guys learned a little something about opiates and opiate overdoses. So thank you guys very much.